Today, we're going to be focusing on the exciting data that was presented at ASCO GU this February, February 13th to 15th of 2025. So, Karine, you were there in San Francisco the last few days, so let's dive right into it, going through all of the GU updates, starting with kidney. What data was presented that you were excited about?
Absolutely. I'm going in reverse order this time. So we're going to go kidney, bladder, prostate. And so
Mixing it up.
yeah, some of the exciting data presented as far as kidney cancer goes, there was the first phase 3 triplet combination that was presented. So we know that we've had ipi-nivo based on CheckMate 2 and 4 for some time now. And there was a presentation on cabo ipi-nivo, so that triplet combination versus placebo ipi-nivo. And there was a PFS benefit for that triplet combination, but the OS was the same in both groups. So it was 41.9 versus 42 months. And only one half of patients got subsequent treatment. So mostly they got TKI, which is usually what we do with that game of chess in second line, third line RCC. 10% got immunotherapy, and we know based on some recent trials in the last few years that there is no benefit of immunotherapy rechallenge in metastatic RCC. And a minority of patients receive HIF-2 alpha, which also has been an approval post-IO TKI now in the last few years. And another thing that I just wanted to note for this trial is that because of the toxicity of the triplet arm, there was an underexposure of cabozantinib overall. So the median was 22.4 milligrams. And then for ipilimumab as well, with only 58% of patients receiving all 4 cycles.
Great. Thank you. And so next, tell me about this KIM-1. So that's kidney injury marker 1, which we heard about a little bit at ASCO. What did you guys talk about at ASCO GU this year?
Absolutely. So there's been a lot of interest in terms of finding better biomarkers in all cancers, but specifically in kidney cancer, we've been hearing about this KIM-1, which was first studied actually in ATN. And they looked at it for this abstract in CheckMate 214, which again was ipi-nivo and metastatic RCC. And they found that an early decrease in KIM-1 just 3 weeks after starting ipi-nivo is associated with long-term efficacy of this immunotherapy doublet. And then the KIM-1 decrease, interestingly, was not associated with sunitinib response. Another thing that's important to note is that higher baseline KIM-1 is associated with worse clinical outcomes among patients treated either with the ipi-nivo or with sunitinib. And so people are talking, maybe there's going to be a future use of using this for a more risk-adapted approach to predict response to immunotherapy. We know that ctDNA is not overly useful in kidney cancer, so we're looking for different biomarkers in this space.
That's great. It's very exciting. And so tell me about any posters in the RCC realm that caught your eye.
There was one interesting poster by Casey Cure that I thought was very impactful to better understand the patient perspective. And so they described that 44% of patients with metastatic RCC spend hours thinking about their cancer. In the last 90 days, 36% have gone to the ER. A third of patients say that cancer always or often impacts their ability to eat, sleep, and engage with family and friends. So the bottom line is that surviving is not the same as living, and we need more research to improve the care and alleviate the disease burden in RCC.